Today's lecture is going to discuss steri-stripping of a wound, and here is my wound right here, adjacent to my stapled wound. Unfortunately, this patient's getting a lot of injuries these days. What you'll find in your pack is everyone has a minor procedure pack. So oftentimes when we get material either in family practice or urgent care or emergency medicine, we all get a wound care kit. Sometimes that will come with some instrumentation. You will get this minor procedure pack, which actually has some additional items that would have come in that laceration tray. And again, you can use that laceration tray even if it means steri-stripping that patient or stapling that patient back together. So then I think nice things that come into this area are something called a fenestrated drape. A fenestrated drape is nice because it will always have an opening, and the opening allows you to place that opening over the wound itself to potentially just isolate that wound out. The other thing that will typically come within your pack is 4x4s and additional towelettes, okay? But just to cover simply today in terms of steri-stripping and what to plan for that patient, when you're opening any type of pack, just remember as you open this pack, you are sterile on the inside, so then you can safely take your mastisol and your steri-strips, and you can actually place them and open them onto that sterile field. You can subsequently cleanse this wound, really irrigate this wound out. If you were concerned about potential debris within this area, a great thing to use is to draw up some normal saline in a 10 cc syringe and just repetitively, 10 cc's after 10 cc's, jet irrigate that into this wound, okay? You would prep this externally with some chlorhexidine or with some betadine on the outside, but one thing you want to make sure that you do prior to actually steri-stripping the patient closed is you want to ensure that the wound is dry, okay? We're going to be applying mastisol to this surface, and mastisol is going to make that skin surface nice and tacky, so the steri-strips will actually fit better to the wound and stick better to the wound. So we want to make sure that we take some of those 4x4s and we actually blot that prep solution off of the wound so that we actually have a dry wound to work with. When we're going to break the ampule of the mastisol, we simply need to pop it. You'll start to activate the solution. Then again, here is my wound, and I don't want to go into the wound with the mastisol. I want to go just to the lateral borders. Let that dry just a little bit. Then you can take your steri-strips. Steri-strips always come with two parts that are going to be fenestrated on either side. So you can basically peel one side off on your steri-strip. Now the way I prefer to do this, there's multiple different ways. Some people will actually grab a forceps and actually place each steri-strip across. The easiest way that I have done it in order to reapproximate the wound is I've simply placed all three on one side and held my finger. Pulled back the steri-strip and then laid it across the wound. And as you lay it across the wound, everything else will naturally come off. The nice thing about doing it in this fashion, the steri-strips will be very evenly placed, and then you're pulling tension from one side to the other. And that's always how you want to place steri-strips, pulling tension from one side to the other. So you can actually just do it in this fashion all the way along the wound. Now the one thing I wanted to point out with regard to these steri-strips and all steri-strips is they all come with a different marker in terms of color. Most of them are made by 3M. These are going to be 1/2 inch. Typically that's the largest in terms of width. They're all going to be about the same length, but we're talking width of the steri-strip itself. So these are going to be 1/2 inch by 4 inches, okay? You can certainly go smaller. They have 1/4 inch, they have 1/8 inch, everything's going to be denoted based on the color of the 3M marking. So if you go and you pick up your Steri-Strips, just if you aren't familiar with the colors, go ahead and take a gander at the actual width of the Steri-Strip. You want to ensure that if you have a very large wound, you're not sitting there trying to use 1/8 inch Steri-Strips to close that area. It's going to take quite a long time and may not help with regard to the cosmesis closure of that wound.